By the way, News 2, we continue to be on COVID-19 watch, and as you just heard in Stassi's report there, one of the reasons for a drop in hospitalizations is being credited to antibody treatment. It's a fairly new weapon in this fight, but it's receiving praise and from a lot of people. As News 2's Alex Dennis tells us, 97% of the people who receive that therapy, they avoid being hospitalized.
I feel that if I did not have gotten that treatment, I'm afraid of the possibilities of what could have happened.
Jeffrey Caruth credits an investigational treatment called monoclonal antibodies for helping him recover from COVID-19. Sick and quarantined away from his wife and son, he struggled to breathe.
It just scares you. It's not something normal that you really, have in your life.
Praying for relief, he traveled to Vanderbilt, where he was hooked to an IV for an hour, receiving laboratory-made antibodies that target and neutralize the SARS-CoV-2 virus known as COVID-19.
I didn't feel like anything progressed. I felt like I was kind of at the same, which made me happy. And then as another day went by, I was kind of feeling a little bit better.
Caruth, like so many others considered high risk, experienced an improved outcome following treatment. In fact, data shows 97% of those who received the therapy avoided the hospital.
It's really mimicking what one's own immune system would be doing, but doing it at a time before your body had a chance to make their own antibodies.
Dr. Karen Block is medical director of the COVID infusion clinic at Vanderbilt and explains in order for the antibodies to work, it must be given within 10 days of the onset of symptoms before the virus really takes hold. Due to a limited supply of product and resources, currently the treatment is only offered to those who have significant risk factors that make them more likely to be hospitalized.
While I think this is a wonderful treatment on the individual level, we really think that we're benefiting patients individually. We also think we're benefiting sort of the more global healthcare system by, again, preserving hospital beds and trying to optimize resources.
Caruth, thankful to be here to share his story, says,
Don't hesitate.
Ask your doctor about treatment. Alex Dennis, News 2.
Vanderbilt can treat 24 patients in a day, but other hospitals and clinics, they offer the therapy as well. So we're posting a full list on our website, WKRN.com. Just look for this story.